Hi, I'm Dr. Pratibha Shukla. I'm a medical retina and ROP specialist at Zamindar Eye Center. Today, I want to talk to you about a very serious yet silent eye disease called diabetic retinopathy. Diabetic retinopathy is an eye disease which happens in patients with diabetes mellitus. It mainly affects the blood vessels of the retina. If not detected early, it can lead to serious vision problems, including blindness. India has over 100 million people with diabetes. According to a lot of national surveys, 16.9% people end up with diabetic retinopathy. 3.6% patients have sight-threatening diabetic retinopathy. Around 4 million people in India are suffering from diabetic retinopathy, which can be caught at an early stage only by an eye doctor through a dilated retina evaluation. So, who are at risk at developing diabetic retinopathy? Patients who have high uncontrolled blood sugar levels, high blood pressure levels, high cholesterol, who have smoking and consumption of alcohol in their lifestyle, pregnant females with gestational diabetes, all these are at a higher risk of developing diabetic retinopathy. Diabetic retinopathy is a progressive disease which happens in 4 stages. The number 1 stage is a mild stage where there is a swelling of the tiny blood vessels on the retina. Usually, there are no symptoms for this stage, but only by an eye screening of the retina, the stage can be caught. The second stage is a moderate stage of diabetic retinopathy. In this, more number of blood vessels are swollen, which can eventually lead to macular edema. Macular edema is a swelling in the layers of the retina. The next stage is a severe stage. In this, along with the blockage of vessels, the retina lacks oxygen, and as a result of it, it wants to develop a lot of new vessels. So as a result of it, it reaches to the next stage, which is a very severe stage called proliferative diabetic retinopathy. In proliferative diabetic retinopathy, there can be vitreous hemorrhage, there can be retinal detachment, which can eventually require surgery. So the symptoms may often develop at later stages. It can be difficulty in seeing, which is blurring of vision. Patients can see floaters, that is, they may see something like a hair or a mosquito floating in front of the eyes. There can be color vision difficulties. They may not be able to understand or differentiate the colors, and there can be difficulty to see during the night. Sometimes patients with severe stages also come to us with sudden vision loss. Now, how can we diagnose diabetic retinopathy? It can be diagnosed on the basis of a few investigations. Firstly, we do fundus photography. In fundus photography, we take a picture of the retina and we can show the patients what stage of diabetic retinopathy the disease is in. Secondly, optical coherence tomography. In this investigation is like a CT scan of the retina. It basically scans on all the layers of the retina, and in case of any swelling, we can tell the patient what is the next mode of treatment that is to be taken. Now, there are 3 options for treatment of diabetic retinopathy. Firstly, there is something called pan-retinal photocoagulation. It's like a laser therapy where small laser beams are given on the retina to burn the retina slightly so that there is no formation of any new vessels. Secondly, in cases of macular edema or swelling on the retina, we give intravitreal injections. This is basically a medicine that is injected directly in the eye, and it acts quickly to resolve the macular edema. And in very severe cases, a surgical procedure called vitrectomy is done. It is done in cases with vitreous hemorrhage or retinal detachment because of proliferative diabetic retinopathy. Now, how can you prevent diabetic retinopathy? Only thing that people need to do is keep the blood sugars, cholesterol and blood pressure under control. Regular exercises and walks also help a lot, and an annual eye screening which includes a dilated retina evaluation, is very important for all people with diabetes. Thank you so much.